And welcome to Joy News Prime. From our studios here at Koko in Accra, we are live on DSTV channel 421, GoTV 125, and around the world on myjoyonline.com. I am Carlos Caloni. Tonight, healthcare delivery in many parts of the country under threat as Ghana Health Service reveals 7 out of 10 newly posted doctors failed to report to their regions. Also tonight, over 50 students of KJB Asato SHS hospitalized after suffering from severe heat after a fire razed the boys' dormitories. And anti-corruption campaigners are warning against politicization of the removal process of the special prosecutor and electoral commissioners. We'll hear from the petitioners. And later, controversial televangelist Nana Agrada returns to court today for allegedly broadcasting intimate images of Pastor Emmanuel Appiah on her television channel. Let's begin from the health front because patients in several regions could face serious delays in health care as most newly posted medical officers fail to report to their stations. Out of 463 officers assigned across the country, only 158 have shown up, just 34% of what was expected. The Northeast and Upper West regions remain without a single officer on the ground, leaving communities struggling for basic medical care. Joy News' regional correspondent Rafiq Salam reports that the situation is hitting hard and impeding the delivery of a quality health care.
According to the 2021 Population and Housing Census, the total population of the Upper West region was pegged at 901,501. The World Health Organization has a recommended doctor-to-population ratio of 10 doctors per 10,000 people, which is equivalent to 1 doctor per 1,000 people. The Upper West region, since the days of yore, has been making strides to achieve this target, but has been unsuccessful. The region currently has a doctor population of 82. Out of this number, majority of them are in the Upper West Regional Hospital and a substantive number pursuing various specialist courses. Dr. Josephine Anna Engman Nozal is the Upper West Regional Director of Health Services.
The young medical officers who were supporting in the peripheries have left for school. So there used to be 2 doctors there. One has left for school. Babli, we used to have 1 doctor there. He has left for school. And then I think Lambusi, the medical officer there, has also left for school. So there was a need for us to move some of our doctors from other district hospitals to fill the gap. So currently, as we speak, the district level, apart from 1 municipal, most of the facilities, we have just 1 medical officer.
Dr. Joseph Nuzal was therefore excited when 32 slots were allocated to the region. 30 medical doctors applied to fill the vacancies and were quickly posted to the region. None has so far reported.
Following the release of the list, we have been pursuing the 25 medical officers through calls, WhatsApp messages, text messages, and it's not a very good story to tell because most of them, some are not responding. Those who have responded, they are not too keen to come.
The people already are lamenting about the inadequacy of critical medical staff in the region, particularly medical doctors, stating that the decision of the medical doctors will have a huge negative impact in healthcare delivery in the region. Hajia Muniratu Isa and Alasan Inusa Agambiri pleaded with the medical doctors to rescind their decision.
Why is a good place to work? We have a lot of accommodation for workers and we are very friendly. At least I think it would be a good advantage to many of them if they had agreed. Some of them, not even if not all, would have come. For the few to come, it's a learning process.
Don't support any decision to anybody refusing to come to serve. And so I would plead on to them to really rescind on the decision to come and serve Upper West region and Northern Ghana for that matter.
Reporting for Joy News, Rafiq Salam. Wow.
Well, let's go to the Northeast region now and speak to our correspondent, Ilyasu Tanko. Grateful for your time, Ilyasu. How is the situation actually impacting healthcare delivery based on your interaction with residents in the region? Hello, Ilyasu. You may have to unmute. Right.
Hi, Carlos. Can you hear me?
I can hear you now.
Well, there is a huge impact in health delivery in the region. As we speak, from our checks, we understand that the region has less than 10 doctors serving nearly 700,000 people. In some districts, there are no doctors at all. For instance, the Mampurgu-Muaduri district, the Bunkurugu, and the Yunyo district. And we understand that these less than 10 doctors are found in about 5 health facilities. The BMC in Nalirgu, the Bindi Hospital, the Pasengpe Hospital in the West Mampresi municipality, the Janga Hospital also in the West Mampresi municipality, as well as the Wale Hospital in the West Mampresi municipality. So as we speak, people that are seeking healthcare, especially those from the Mampurgu-Muaduri district, has to travel to the hospital or the health facility in Pasengpe. And then sometimes they are referred to the West Mampresi, the municipal hospital in Wale. Some also have to go to the Janga Hospital, also in the West Mampresi municipality. So according to health authorities, this is having a dire impact on the service delivery in the region.
Right. Thank you so much, Ilyasu. Let's bring in now the General Secretary for the Ghana Medical Association, Richard Salome. We are grateful for your time. Tell us, as an association, how concerned are you about this phenomenon where medical officers posted to health facilities are not willing to go?
Well, good evening to you, Carlos, and good evening to your listeners as well. The Ghana Medical Association has been very concerned about the issue of doctors accepting postings to facilities. And it is one of the reasons for which we have always had an issue with doctors finishing school and having to stay home for too long. The point is, these batch of medical officers have had to stay home for at least 1 year, some staying home for even more than 1 year, with a lot of us having to lobby in the background, speak to the ministries, and appeal to both the government, Ministry of Health, Ministry of Finance, working with them closely to secure these postings. Subsequently, they've just been posted not too long ago. The challenge is that people have had to stay home for quite a long time, having to find other means of survival, some having to do some locums, and some, while in away time, may have started various courses and started schools that may have to look at how to abrogate this. We have actually engaged various authorities and told them and suggested ways of attracting these doctors to these locations. We have, by ourselves as an association, piloted a scheme in the Volta and OT regions where hitherto doctors were not accepting postings to OT. But we realized from the survey that it's not always about just sending the person, go, accept postings and go, but there are other pull and push factors that affect these matters. One of these has to do with mentorship of doctors, senior colleagues who may be close by for you to call in times of trouble.
Right.
And so we instituted a mentorship scheme where when you are posted, you have one person at least attached to you that you can call in trouble. And then assuring them also that they could leave for residency or specialization training when it is due, because you could tell from even the earlier interview by the director that it appears as though those who have left for school, it's as though they found it difficult allowing them to go.
Right.
And that is a challenge, because when you leave to any other place and you realize your colleagues in the teaching hospitals or city centers who have access to locums, who have access to other means, are then having an advantage over you because they can progress much faster, then it is important that other measures are put in place to ensure that you can render your service in comfort, in safety, and then also some incentives are put in place. And so There are other issues. For example, if you are posted to Boku, it is natural for the person to be worried about the security situation over there. And so is worried to be assured, for example, of their safety. And that is why we have suggested that, for example, the regional directors of health services should work with the association to engage members, have a session with them where they tell them the situation on the ground, what
And
measures they have put in place.
Right.
Some have also even called their regions and places where they want to work, only to be told that the accommodation is not ready and others. So we were ready as an association to work hand in hand with government to attract and push our colleagues to accept postings to these areas.
Okay.
And then also, let me just conclude by talking about the fact that there are incentive packages that we have talked about for quite a long time now. The rural incentive package, which the minister has graciously talked about the 20% basic salary top-up as an extra allowance for people who accept postings to rural and deprived areas. This has not been implemented. So we are hoping that some of these things can be worked around this time so that we encourage our colleagues to accept. And all these things are also being worked on at the same time.
All right. Thank you so much, Dr. Salome. I mean, your point has been made. Let's bring in Tony Goodman. He's the Public Relations Officer at the Ministry of Health. You've heard Dr. Salome there raising certain concerns that the ministry must address. How committed is the ministry in addressing these concerns to ensure that the medical officers report to where you post them to?
Thank you very much, and good evening to our viewers. Yes, we have begun something. The Honorable Minister actually was in the Savannah region and met MCs, DCs, including the minister and then the directors in the region, to put in place measures that can attract and retain medical officers that are posted to that region. Because the current policy of the minister is that most doctors must accept postings to the various districts. He wants every district at least should have not more than 2 medical officers in these hospitals to actually deliver healthcare to our people. So he has started going around, at least meeting stakeholders, that we are sending the people to you. Make some amenities available to them. 1, vehicle, accommodation, put in measures that can attract and retain them. Thankfully, in Savannah, when we got there, we're told that about close to about 10 or 15 have already accepted posting to that area.
Right,
because
but beyond those measures, what exactly is the ministry actually doing with regards to what Dr. Salome raised? There are certain key concerns.
We all have our responsibilities. For us in the ministry, we've put in another measure, which means that if you serve in some rural areas and it's time for you to go and do your top-up, your postgraduate, you would be given the opportunity of choosing rather than the one in the city. So these things are there. We have additional measures in terms of adding what we call, when it comes to promotion, we consider what we call deprived communities, and some resources are added onto. But we don't want to start with the monetary aspect now. We want to make sure that these amenities are provided, and then we'll scale it up to providing some incentives in terms of money to them. So these are some of the things we've put in place.
Thank you so much, Tony Goodman. Now, meanwhile, Health Minister Kobina Minta-Kando has been appealing to the medical officers to accept the posting, citing government's commitment to addressing their challenges.
We are distributing not less than 700 medical doctors across the length and breadth of this country. And His Excellency the President has directed that we send these medical doctors to where they are needed most, especially the districts. I'm sorry to say that we have more than almost 50% of the medical doctors we have in this country in the Greater Accra. And therefore, let me take this opportunity to appeal to the medical officers we are posting here at the moment, not to see this policy as punishment, but as an attempt for equitable distribution of the workforce we have in this country. And of course, government will also be seeking to create that congenial atmosphere for you to deliver your work.
Health, over 50 students of KJP Asato SHS in the OT region have been hospitalized after suffering from heat exposure during a fire that razed one of the boys' dormitories. Authorities are now scrambling to find alternative sleeping space for the affected student whose belongings were destroyed in the blaze. There's more in the following report.
The Tuesday morning fire swept through the boys' dormitory, destroying one room completely. Smoke and heat forced students to scramble, trying to save whatever belongings they could, with some collapsing from exhaustion and anxiety.
So I was in the class, and then I heard noise from the dormitory. So as I rushed to the dormitory, I went and reached, smoke was coming out of a dormitory, some 2 dormitories. So as I tried to see, students were trying to remove things that were inside those dorms. So as they were trying to remove all those things, as they entered, they were not able to see the particular things that were for the students. Everything got bent.
Efforts by the Ghana National Fire Service were hampered as the district's fire tender is out of service, leaving firefighters to rely on limited methods to contain the blaze. By the time the fire was put out, nothing in the affected room could be salvaged.
32 people with their choppers, everything got bent. They are just, some of them are even crying because they suffer before they get the money to buy their things.
School authorities and community members rushed to stabilize the students and provide support, but the challenge of finding safe sleeping arrangements for those affected remains. The school authority is calling for urgent support to prevent such disasters in the future.
To bring in our T-Regional correspondent, Peter Senu, who actually has been following this particular story. For us. Peter, we understand about 50 of the students have been hospitalized. Tell us about their situation, as well as the minister who actually visited the school.
Yeah, Carlos, in your shot now is the arrival of the students from the Jessica Government Hospital. They are just arriving. And the school bus just brought them from the Jessica Government Hospital. So if you can see the numbers, some are still coming out from the bus, so to speak. Some not looking too good, some not looking too healthy. So this is the arrival of the more than 50 students in the Jessica Government Hospital. So that is what I can report now. But earlier, some 10-15 minutes ago, the regional minister himself was here to ascertain the situation for himself, and then he visited the grounds to see what exactly happened. So we can say that we are showing the school that government will be fixed as soon as possible, so that the student can have a place to rest and while they attend to their lessons. And also, the place that has been provided for them to temporarily sleep is an abandoned project that the minister says government is committed to ensuring that it's completed on time, so that the student can occupy that space. So that is what has been happening. Of course, the school authorities to have this evening ask the students that there is not going to be any prep for them, and that they would have to go and rest and attend to themselves. Those who may want to wash would have to wash and get ready for tomorrow. Of course, tomorrow too has been declared a lesson-free day for the students, so that they can nurse. Those who want to nurse their bodies will nurse. Those who want to nurse their wounds will attend to themselves. So this is what the situation is as we speak. Carlos.
All right, thank you so much, Peter Seno, for the update from the Asato school in the OT region. You're still watching Joy News Prime with me, Carlos Kalone. We'll take a short break. Stay with us. Welcome back, and thank you so much for staying with us. Now, about 30,000 people in the Ashanti region may be living with HIV without knowing it. Health officials say only half of those projected to have the virus are on treatment. Ohime Tewia reports.
The Ashanti region saw an improvement in persons living with HIV on treatment from 25,891 in 2024 to 33,100 199 in 2025. This represents a 28.2% increase over the period. The region also saw 6,293 new clients on treatment as compared to 5,201 over the same period last year. Ashanti Regional Director of the Ghana Health Services, Dr. Fred Adumaku-Boateng, who attributes the gains to the dedication of healthcare workers and stakeholders, say there is more work to be done.
Out of the estimated HIV population of 63,159 in Ashanti region that are supposed to be on treatment, we have only 33,199 on treatment, representing 52.9% of those who are supposed to be on treatment. Approximately 29,960 individuals either do not know their status or are not on medication. And this gap poses a significant public health risk.
Percy Kuranche, who has been living with HIV for the past 35 years, told a World AIDS Day commemoration event that stigma, especially in the media, is still high.
Living with HIV for almost 35 years now, and I'm on medication. So I advise all my people who have been tested positive to go for their drugs, take their medication well, and they will live strong as I am. And the people who have not yet tested should also go and test and know their status so that they can also stand firm and then continue with their medication.
Meanwhile, Dr. Adumaku-Boateng wants the youth to take advantage of PrEP, a safe daily medication that reduces the chance of getting HIV by more than 90%. From Kumasi, for Joy News, Ohime Teria reporting.
Well, workers in the informal sector are being trained to better understand the Labor Act. The training is aimed at preventing harassment at the workplaces. Bono East Regional Correspondent Anas Sabit has more.
They are the engine of our economy, the skilled hands and tireless hustle that power our daily lives. But for millions in the informal sector, the workplace can be a landscape of uncertainty. For far too long, issues of violence, harassment, and a lack of basic workers' rights have been a silent struggle, an accepted part of the grind. But now, a new movement is aiming to change that. Here at the Brunjambem Hall in Techiman, a collaboration between ActionAid and the Ellen White Sustainable Foundation is bringing a crucial message to those often left out of the conversation. Your dignity at work is non-negotiable. Ya Ose Boateng is a programs officer for ActionAid.
Going forward, we are looking at, after we've met with these people, these employees, we are looking at working with employers so that we can get also their perspective on some of these issues and how we can bring them together to collectively look at these issues and how it can be addressed.
The call is for a cultural shift from a tradition of absolute authority to one of mentorship built on mutual respect. Founder of the Ellen White Sustainable Foundation, Mrs. Ellen, described the initiative as a direct step towards reducing gender-based violence in our communities.
So, gender-based violence in general is something that is causing a lot of harm, and so we have to address it from their side too. And so today we met them generally to address issues of gender-based violence. We wanted to know the challenges they go through when it comes to gender-based violence and how best we can all resolve it.
Some of the beneficiaries thanked the organizers of the program and noted that the training has shaped their thoughts when it comes to work-related harassments. Reporting for Joy News, Anas Sabit, Techiman.
Now, let's go to the Ahafo region, where students in Gosu are being urged to stay clear of drugs as concerns grow about rising abuse among the youth. The National Youth Authority has stepped up its outreach, meeting learners across the Ahafo region. Correspondent Emmanuel Edu Jemfi reports.
The National Youth Authority brought together students from Ahafo Senior High and Technical School, Sankore and Mem Senior High Schools as part of efforts to scale up awareness about drug misuse. Ahafo Regional Director of the NYA, Nicholas Sowa, said the campaign will be extended to Hidium and Joy and Kwanta to ensure that students across Asutifi North and South, Tano North and Tano South also benefit.
The National Youth Authorities embarking on this project will reduce the drugs in the system. You know, the youth nowadays, the way they are dealing with drugs is quite appalling. So the National Youth Authority has decided to embark on this project.
Assistant Narcotics Desk Officer Davis Osubempa said that although authorities continue to secure official borders, traffickers still use unapproved routes to push illegal substances into local communities.
But they pass it, they bring it to Ghana through the unapproved routes. And then we are finding it difficult. So as we always say, we are pleading on the government to get something to be done about these things.
National Anti-Drug Advocate Alaji Kofi Kunto urged enforcement against unlicensed medicine sellers and illegal drug distribution networks.
Enforcement on the drugs is not strong as me I'm expecting. You can meet an Abochi man selling drugs on the road. And some unlicensed chemical stores too are selling it.
Some beneficiary students share the knowledge they have learned with Joy News.
They even say that if you take in drugs, you can learn hard, you can do something hard. But it's not like that. Sometimes you have to use your own strength to do something.
And today we learned about drug abuse and we learned how to desist from drug abuse.
The National Youth Authority says it will continue to expand the Red Alert campaign until every district in the region has received comprehensive anti-drug education. Emmanuel Edujempe reports from Goso in the Ahafo region for Joy News.
Let's focus on the legal matters now, because the High Court in Accra has ordered lawyers for Nana Agrada and her co-accused to file their proposed plea ahead of next hearing. At Tuesday's hearing, prosecutors hinted at a bench warrant for the second accused, but the defense said they had not received proper notice. Agrada is facing charges of broadcasting intimate images of a complainant without consent. Fatal Bayaga reports.
Lawyers for Nana Agrada told the court that negotiations with the Office of the Attorney General regarding a plea bargain are progressing positively, noting that both sides have made considerable headway. The prosecution also confirmed that the complainant, Emmanuel Appiah, has been involved in the plea discussions and was physically present in the courtroom. The trial judge then instructed the registry to ensure the second accuser's counsel is duly served with a hearing notice before the next sitting. The matter stems from accusations that Nana Agrada, once a fetish priestess and now an evangelist, broadcast intimate images of Pastor Emmanuel Appiah, popularly known as Osofo Appiah, on her television channel and across social media without his consent. Prosecutors say the images were aired during a live program where panelists allegedly ridiculed the pastor, an act they argue violates the Cybersecurity Act 2020, Act 1038, which criminalizes the non-consensual distribution of intimate content. Despite currently serving a 15-year prison sentence in a different case involving defrauding by false pretense, Agrada was transported to the court for this matter. Nana Agrada appeared calm and composed throughout the court's proceedings. However, her physical appearance showed a shocking transformation. She appeared darker in complexion and leaner than before, a change that was striking. Meanwhile, the case has been adjourned to December 16, 2025. For Joy News, Fatal Bayaga, Accra.
We have more stories after this break. Please stay. Welcome back. Let's now take you to Parliament, because Minority Leader Alexander Afenyomarkin has slammed the government over unpaid road contractors, saying it's time to end rhetoric and take action. His criticism comes as government allocates 5.3 billion cedis to the Roads and Highways Ministry under the flagship Big Push program. He also condemned the dysfunction of the road fund and its negative impact on private businesses investing in road projects. James Avaji has more from Parliament.
The jostling, literally, between the two sides of the House began with the approval of the budget allocation for the Roads Ministry when MP for Fuasia Yorubi Kojo Nkrumah spotted what he describes as inconsistency in government expenditure on the Big Push in 2025.
They had programmed that they will spend 9.9 billion on the Big Push. The first challenge, Mr. Speaker, is that the report claims that they have spent 10 billion on the Big Push. Why that cannot be correct is that the Big Push was launched on the 16th of September. It cannot be possible that between the 16th of September and the end of September, as this report is saying, 10 billion cedis worth of certificates of some sort had been presented, processed, and paid within that 2-week period.
His statement led to a banter between the roads minister, the majority whip, and the minority leader, who called out the majority and the government, describing the budget as a cut and paste and poorly prepared document.
Cut and paste budget. You launch Big Push, you say you made payment to contractors under Big Push in less than a month. Mr. Speaker, this can be nothing less than a very lazily prepared budget. You just put in out the numbers. You don't do any due diligence. You come to this parliament, you didn't scrutinize. You mean you didn't read your own budget? I will not use the word incompetence. But anybody reading this would wonder why a government with the opportunity to put in place the governance structures has refused to set up the road fund board.
One district, one factory. They were begun and public expenditures were spent on them before they were launched. Today they tell us that they are surprised that Big Push has expended money on projects that had been begun earlier this year. They haven't heard them before.
Away from that, traditional leaders are raising red flags over the effectiveness of NIMOS, the government's latest anti-illegal mining task force. The chiefs say despite its efforts, NIMOS' approach of swooping in, taking action and leaving is failing to yield a lasting result, say the chiefs. Now, Maxwell Akloboto has more in the following report.
Illegal mining continues to escalate, polluting rivers and destroying forest reserves, despite several government interventions, including Operation Vanguard, Operation Galam Stop, Operation Hold 2, and the recent NIMOS initiative. Almost 6 months after NIMOS launch, traditional leaders in the hardest-hit communities say its operations are ineffective. At the launch of the Galamsey project, Turning the Tides, they urged government to empower local communities to lead the fight. Nana Kwame Nkansa II is the divisional chief of Jomoro in the traditional area.
So we realize that the government is spending a lot of money to prevent illegal money, but you realize that the country is big and the NIMOS come and leave. So we are saying that although they can come in once in a while when there's we need an extra force, but the community should be empowered, because in the community they have the direct effect of the illegal mining. They have seen their waters being destroyed, they have seen the forest, the pits not covered. So we believe that the government should empower the chiefs and the communities. You should have the task force in the various communities to fight against illegal mining in the area more than the NIMOS, because eventually NIMOS will come and they will go.
For Jacob Ryden, Senior Director of Strategic Projects, as preferred by nature, despite the need for pooled efforts in the fight against Galamsey, the real drive must come from the various communities.
One solution to the issue of Galamsey, I really think it takes collaboration across many different actors. So the way we see it as an international environmental organization, we can work with local partners here in Ghana to empower and train local communities. But it's important that the solution to Galamsey really comes from the communities themselves.
Project Officer at Rikoto, Victor Abugri, explains how the Galamsey project, which focuses on mobilizing cocoa growing communities, aims to help reduce illegal mining activities across the country. As Ghana intensifies the fight against Galamsey, chiefs and development partners insist that real progress depends on empowering the affected communities. They say national efforts like NIMOS will only succeed when local voices lead the charge. For Joy News, Maxwell Aklobatos report read to you.
Now, farmers in the 5 regions of the north are calling on government to back indigenous poultry production. They warn that Ghana's heavy dependence on imported chicken is crippling a sector that already supplies most of the country's birds. Northern Regional Correspondent Martina Bugri reports.
Poultry meat is a staple in Ghana, served at homes, in restaurants and at celebrations. But despite this, the country relies heavily on imports to meet its demand. Ghana imports about 80% of poultry. But the president of the Indigenous Poultry Farmers Association, Isifu Basudin, says it was unacceptable for Ghana to continue creating jobs for other countries instead of its own people through imports.
I was very sad of hearing the news from the president's home voice that Ghana imports poultry meat about 88% to this country, meaning that we are creating 88% job for other people from other countries. It's a shame whilst we are here in Ghana and we don't have jobs.
The Marketing and Digital Communications Officer, Bayo Robert, said they want support for local farmers to produce quality meat for its own people.
We want to be able to feed ourselves, produce what we eat, and so that we can live healthier lives. These meats that are being imported, you don't even know how long they have been preserved for. Meanwhile, you can get fresh meat off the streets of your country in Ghana in order to be able to consume.
Some of the people who were there, Ajia Kande Abukari and Yakubu Memunatu, highlighted the benefits of investing in local poultry.
I started with 2 fowls, female fowls 2, and then 1 cock. So that was what I was doing. Luckily, I was able to take care of my children. They've all completed their school. They're all working now. They are looking after me.
I'm here to support them so that they will create more jobs for the youth. Especially the young girls and the young boys who leave their homes to go and do Kayayo and then Galamsey. If many NGOs come together to support this indigenous poultry farming, it will give them more jobs so that the youth can engage in it.